Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Anna Mazzei. After receiving her Bachelor's of Science degree, Anna attended a dietetic internship at Mercy Hospital in San Diego. Anna started at Washington Hospital in 1986 as an inpatient dietitian. Currently, she is an outpatient dietitian providing education on diabetes and weight management and conducting community lectures. She is certified in weight management from the American Dietetic Association and has also been a certified diabetes educator for more than 10 years.
Tonight's talk is on the peaks and pitfalls of vegetarian diets, especially related to diabetes. So first, let's talk about who follows a vegetarian diet and why do you think? Our 2012 Gallup poll showed that about 5% of the population says they follow a vegetarian diet. Okay, about 2% follow a vegan diet, and we're going to define that in a few minutes. There's more females who are vegetarian and more unmarried people who are vegetarian, which is kind of interesting. And the primary reasons go in order here: 8% for religious beliefs, 10% for environmental purposes, and for just food preferences. You know, they like the taste of that better than meat, and 20% for just following a healthier diet, want to reduce their risk of different medical problems, and 30% to reduce the animal suffering, or have reasons to do that. That came from the Human Resource Council in 2013. And they are in good company, because look at all the famous people who claim they are vegetarians, right? Now, I don't think that Albert Einstein or Ben Franklin would think they had anything in common with Madonna and Pamela Lee Anderson, but they do. Okay? Also, Bill Clinton, who was a notorious fast food eater, right? He's, cleaned up quite a bit ever since he had his cardiac procedures, and now is a vegan. So he's lost about 25 pounds and speaks highly of doing it. So let's look at the different types of vegetarian diets, because I think when you ask somebody, are they vegetarian, usually they're going to say they're avoiding probably red meat and maybe some other animal product. But it usually falls into these categories. A vegan avoids all animal products. So even any baked goods made with eggs are out, and dairy products. So it can be a little bit more challenging to get all your nutrient needs met on a vegan diet, but it can be done. And hopefully they don't wear any leather shoes, okay? Lacto-vegetarians avoid, they don't have any meat or eggs, but they do allow dairy products, milk, cheese, yogurt, that type of thing. And the lacto-ovo has both eggs and dairy products included, but avoids the meat, seafood, and beef. And then there are people who kind of go back and forth a little bit. They'll allow chicken and fish, but we'll stay away from things like beef, pork, and lamb. So those are the three main categories of vegetarian diets. But in my mind, even though we saw that Gallup poll, it showed only 5%, and what's interesting is that when they look at different segments of the population, they see that similar distribution of people who say they're vegetarian. But I think people have a growing interest in it. It's no longer really considered a fad or like an alternative lifestyle. So I put this slide together because I'm just reminded of all the things I've been seeing related to a vegetarian diet. When you go to even fast food places now, they're using soy-based products. They're using flavored tofu in different dishes like burritos. And if you go online, of course, if you type in vegan restaurants in a different city, it's going to come popping up all over the place. And I've seen different lines of frozen meals offering just a vegetarian cuisine, and even other major lines of frozen meals, in addition to what they normally offer, offering strictly vegetarian. And a few weeks ago, Oakland had their Veggie Week to kind of teach the community there about the benefits of eating a vegetarian diet, some of the environmental impact you can make by following a veggie diet, and so forth. So that was just a few weeks ago. Now, Meatless Monday. Anybody heard of Meatless Monday? Okay. Actually, it started during World War I and World War II as an effort. The government said, can you give up one of your days of meat in order to support the war effort? And most recently, it's part of something called the Monday Campaign, which is backed by several leading public health institutes like Johns Hopkins. What they wanted to do is start Monday out, the first day of the week, with doing some behavior that promotes good health. So hence they started to do Meatless Mondays. So if you give up meat on that first day of the week, you might be lowering your saturated fat intake, and in that way, lowering your cholesterol, and then lowering your risk of heart disease, okay? So speaking of medical problems like heart disease, when we look at the peaks of a vegetarian diet, studies have shown that a vegetarian diet is associated with lowering your risk of cancers, and there are specific ones: heart disease, hypertension, and even diabetes. And many studies show that vegetarians as a whole are of lower weight. And in that way, if they are of lower weight, a healthy weight range can lower your risk of these other medical problems. Now, typically, a vegetarian diet is going to be low in cholesterol because only animal products make cholesterol. And if you're selecting correctly, it'll also be low in saturated fat. And it may not necessarily be low in total fat, but it can be because you're not using a lot of those meat products that are inherently high in fat. It's typically high in fiber because once you start cutting out meat, you're going to eat more vegetables to feel satisfied. And it helps to delay the onset of hunger. And of course, higher fiber diets aid in proper digestion and elimination and can alleviate some common problems that people have, like diverticulosis. It is naturally high in phytochemicals, which are plant compounds that we know help to lower our risk of diseases, and I have a detailed slide on that coming up. And it does have a lower environmental impact, of course. If you look at cattle, cattle requires quite a lot of feed, water, and fossil fuel to turn plants into protein, okay? For example, to produce 1 calorie of beef requires 40 calories of fossil fuel, where 1 calorie from grains requires only 2.2 kilocalories, okay? And overall, it can be less expensive. I mean, beans are usually less expensive than chicken, beef, those types of things, okay? Some of the pitfalls, I don't think there's many. I think it's about changing our mindset, getting used to not looking at a big hunk of beef on the plate, you know, looking for more interesting things, thinking outside of the meat box, so to speak, okay? I also think that you can't think positively about a vegetarian diet. It's not just lima beans and Brussels sprouts, okay? There's so many options now and so many resources to make a vegetarian diet much more interesting, palatable, and very satisfying. I think that if you want to do it, you might have to, you know, model the experience for other people before they join in. You may not get support right away. I think it might be a challenge sometimes at restaurants and special events, but I think that if you embrace it and you model that behavior and show people that it can be very satisfying, they'll follow suit, okay? First off, I think that you've got to start planning. What does it involve to follow a vegetarian diet correctly? And then do some shopping and preparing meals. So there's going to be a little investment of your time to do it right. Because, for example, you don't want to end up eating these kinds of foods that somebody just on a whim might think, let's follow a vegetarian diet and just eat bagels, right? A Diet Coke is vegetarian. It's not made from animals. Or fries, okay? A candy bar, maybe pizza has a little cheese on it. That's a quick vegetarian meal, but you need to definitely expand your horizons in terms of meal planning than sticking to this, okay? Because you will suffer some of those nutritional deficiencies we have concerns about in a vegetarian diet. The position statement from the American Dietetics Association, now known as the Academy of Nutrition and Dietetics, their position statement says that, an appropriately planned vegetarian diet can be healthful and nutritionally adequate and can provide health benefits in the prevention and treatment of certain diseases. And again, a well-planned vegetarian diet is appropriate for all stages of the life cycle. So you wouldn't think that either, but it can be with proper planning, and even for athletes. So let's look at some nutrients we're concerned about. I think that a lot of people might wonder if they're going to get enough protein on a vegetarian diet, and surely you can. Most Americans get more protein than they need to begin with, okay? So of course, if you're a lacto-ovo, it's not a problem. You can eat eggs, you can have milk. If you are a vegan, you can go to the soy products, right? And beans and lentils, of course. And additionally, iron, it might be a concern because you're not eating that red meat anymore, or the chicken, or those animal products. But again, beans and lentils have iron in them, and thankfully we have so many fortified products now. I mean, even for children, they eat in that first year of life fortified cream of wheat. So that's a good source of iron right there. And green leafy vegetables, the iron is not as available to the system, but when you eat vitamin C foods high in vitamin C with the green leafy vegetables, it helps the absorption of the iron. Calcium is another concern if people are getting enough calcium, but again, if you're a lacto-vegetarian, you're going to be able to get it because you're going to be eating the dairy products. But of course, we do have many calcium-fortified milks now. The soy milks, the rice milk, the almond milk, they're fortified with calcium and vitamin D. And interestingly enough, tofu, if it's prepared with calcium compounds, like they're called calcium salts versus magnesium salts, they can have quite a bit of calcium. So tofu is kind of a new food to most people, but there's definitely different ways to prepare it where it's acceptable. Vitamin D might be another one if somebody's not drinking any fortified, milks. Also remember that vitamin D is naturally occurring in our body. It's a pseudo hormone. And it can turn into the active hormone if we expose our bodies to sunlight. And it doesn't have to be so much sun that we're going to worry about, skin cancer. It's just a few minutes off and on throughout the week, as you can see. B12 definitely is a concern because it's only found in animal products. And again, because we have fortified products, that problem's resolved, okay? Zinc, too, is a concern, but it's found small amounts are found in these variety of foods. If someone does not eat seafood, they're going to be missing out on omega-3 fatty acids. But a similar compound can be found in different nuts, like walnuts, and even in soybeans. And you might find yourself eating more soybeans if you do adopt a vegetarian diet. But when you evaluate your meal planning, all of it, you might, if you feel like you're falling short, you could just get a standard multiple vitamin to make sure that you're getting everything that you need if you're insecure about that, or maybe a specific nutrient, okay? But let's go through the different food groups and talk about the best ones to select and eat, the best choices in each food group, okay? So in the meat and protein food group, since you're not eating meat, you're going to be dependent on beans to get your protein, beans and lentils. And as people with diabetes need to know that these are very nutritious foods, but they do contain carbohydrate. One serving is about a half a cup, and it contains about 15 grams of carb. That's 1/2 cup cooked, okay? It's more economical to buy them in bulk, and there are several different ways to prepare beans nowadays. They have these really sophisticated pressure cookers available. There's the quick method of cooking beans, and I can talk about that a little later if somebody has any questions about that. But you can buy beans canned now. I mean, there's so many different kinds of beans available, and they come even lower salt. If you rinse them out, you lose about 50% of the sodium too, okay? You can increase the iron absorption from the beans, as I was mentioning, by including a source of vitamin C with it. So like when you have chili beans with tomato, you're going to be enhancing the iron absorption because the tomato's in that pot of chili, okay? So these are all the great looking dishes that you can make, okay? Trying to stimulate your appetite towards being a vegetarian here. So soy products are also important to include because they are actually the lowest carb, highest protein bean, and that's why they are used in a number of different ways. So you might have seen the edamame beans, which means it means immature bean. They come with the pod on, and off, and you can find them frozen. They also, of course, tofu is available in different textures. You have soft tofu or silken tofu that's used for different kinds of dishes compared to extra firm tofu, which is used for stir frying. They've even done something called, they've taken the soy protein and made something called textured vegetable protein to give you something that looks like beef crumbles that you can throw in to make a spaghetti sauce or add it to a chili bean recipe. And of course, there's different veggie burgers on the market, and I want to show you a label of one of those in a few minutes. And they have chicken nuggets now that are made with, it's amazing that they taste, some of these veggie burgers and chicken nuggets taste better than the real thing. When you use these soy products, it's important to check the food label, okay, for the carb content, because they're adding other ingredients too. Now, nuts and seeds and their butters, like peanut butter, do have protein in them, but they are sort of a higher calorie protein source. So you got to be careful about that if you're watching your weight. And of course, we have eggs and egg substitutes or egg whites that are available for people who are the ovo vegetarians, allowing eggs. So let's look at this slide right here. One patty contains a total carbohydrate of 12 grams. Okay, close to like what a half a cup of beans is. Okay, 9 grams of protein. That's a little bit more than an ounce of chicken would provide, or an ounce of meat. But it is a little high in, not too bad in sodium, but that's what you got to watch for. It's a processed food, so you have to be careful with. They flavor it with sodium to make it taste good. So just make sure you check the label for the carb, okay? Because then you'd have to add that in. So when it comes to dairy products, usually a serving of milk or yogurt is 6 to 8 ounces. And on the average, it might on the average have 15 grams of carb. So you want to select 1% and non-fat choices in this group. Most recently, in the last couple of years, you're seeing more Greek yogurts available. Anybody try Greek yogurt in here? Okay. They're very satisfying because they have double the protein of regular yogurt. So they've made a big hit at the marketplace. So here we have cheese and cottage cheese you could select. They have minimal carbohydrate, but you do have to watch the fat content because cheese is naturally a little high in saturated fat. So you have to watch your portion there. And there's some lower fat cheeses available and non-fat cheeses, but again, it's some trial and error there to see if you like that. The soy milk and yogurts. I have seen the carbohydrate content vary quite a bit. If it's flavored, like with chocolate, you'll see up to 20 grams of carb. And sometimes when it's not flavored at all, it's as low as 5. So you've got to check the label on that too. And of course, the soy milk is usually fortified with calcium and vitamin D too. Okay, so let's look at this label back here. Okay, the label of the yogurt. Okay, so the blue label, you see I'm trying to see if I move this. Here it is. Okay. One container has 12 grams of protein, 20 grams of carb. That's a fruited Greek yogurt, okay? And then this is a regular yogurt that is something like a no added sugar, or maybe with fruit in it, or maybe with a sugar substitute that's got 16 grams of carb and 5 grams of protein. So that's what I'm talking about. That's quite a bit more protein in there. And that's a 6-ounce serving for both of those. When it comes to starchy foods, a serving size, one serving usually has 15 grams of carb. If you're a diabetic, you probably know that. One carb choice is 15 grams of carb. So the serving size can vary from a 1-ounce portion of bread, 1-ounce portion of tortillas, that type of thing, or 1/3 cup to half cup cooked. It's usually a cooked product we're talking about. So the other starchy vegetables we talked about were the beans and lentils, but here you have corn, potatoes, and yams. They're going to stay in the starchy group because they don't really have as much protein to offer. And there are many kinds of grain products available now, and of course we're always encouraging people to have 100% whole grains. The 2010 dietary guidelines really recommend that at least half of your grain servings be from whole grains. So there's such a variety available now. Many stores have these products in bulk, and even recipes may be right by there for you to try. So experiment, okay? There are just a lot of different and interesting flavors and tastes and textures out there. And the reason why we want you to include whole grains is because they're not processed. it stays intact. The bran part stays intact, where you'll find the fiber and B vitamins. And the germ part has more B vitamins and those potent antioxidants that help reduce our risk of diseases. The endosperm is what's left after you strip the whole grains from the bran and the germ. You just get carbohydrate and maybe some protein in there, okay? When we come to the fruits and vegetables group, the key there is to try to stay with foods that are in season and select the whole food and move away from using the juices. So one serving of fruit is usually 15 grams of carb. Of course, we never know exactly because fruits can be underripe or overripe. You're never really sure the exact, how much something weighs. But a general idea is that a tennis ball sized piece of fruit, apple, orange, peach, pear, is about 15 grams of carb, or some fruit cut up that equals 1 cup. And as I said, we recommend whole fruits over juices. And nowadays, there's a lot of different canned fruits packed in their own juice, or they come unsweetened, and maybe some of them have a sugar substitute added to keep some extra sweetness. Vegetables that are not the starchy ones, I'm not worried about. We usually encourage people to eat liberal amounts of those. They only have 5 grams of carb. So usually a serving is a half cup cooked or a whole cup raw. And again, if you're looking for canned vegetables, try to find those that are unsalted. The frozen vegetables are available all year long, and the nutrient content is contained in those when they are picked and frozen, and usually they do not have a lot of added salt at all, okay? So look at all those fruits and vegetables and those colors. Doesn't that make you hungry right there? Okay, a lot of berries in season now. This is the purple cabbage. These are onions. So great pictures. And all these colors equal phytochemicals or phytonutrients that help us reduce our risk of disease. And these are the fancy chemical names of these. And it talks about the benefits of each of these different phytochemicals. And this is a short list, okay? And the color associated in the vegetable with these different phytonutrients, what foods you might find them in. So lutein is usually yellow-green types of vegetables, green leafy, and it helps with vision. And same with these, the bioflavonoids. There's a vitamin out there actually that many ophthalmologists recommend to their patients to help who have cataracts to take a certain vitamin that has those phytonutrients in them and certain actual vitamins in there too, okay? So here we have garlic has a phytonutrient called allicin, and it helps to reduce risk of heart attacks and cancer, helps to lower blood pressure and cholesterol. It's also found in onions, okay? The dark purple color, those are the anthocyanins, and that is a powerful antioxidant that's found in the blueberries, okay? So take a look at those in your slides, okay? When it comes to the fats and oils food group, we want to select those that are vegetable-based. So the oils that come from nuts and seeds are usually low in saturated fat, high in monounsaturated fats or polyunsaturated fats that help to lower our bad cholesterol and increase our good cholesterol. So if you're going to use margarine, it is preferred to use a soft tub margarine. When it comes to other types of animal fats, you should select the lighter or lower fat type. So instead of half and half or cream, there are fat-free creamers out now. Instead of high-fat cream cheese, there are light and non-fat types. Okay, so let's look at a sample menu. Okay, here's breakfast. A cup of cooked oats. You can make it with the 1% low-fat milk. Throw in some raisins and cinnamon. Have a little, to give it some texture, throw in some roasted walnuts and have a little veggie patty with it. At lunchtime, you could have some chili beans that you made, and I put there that you may have included some oil in there, corn tortillas, a little shredded cheese, and then a big salad made with a variety of vegetables and some oil and vinegar dressing. Then at night, you would buy maybe some extra firm tofu to make a stir fry with, again, mini vegetables, a variety of vegetables, and have some strawberries as a dessert. You could top the stir fry with some roasted nuts. And there are some snacks that you could have. Each of these meals has about 60 grams of carb, which is not excessive. The snacks are somewhere between 15 and 20. So that is not something different than what I tell my patients who have diabetes. So the calories here might be somewhere in the range 18 to 2,000 calories, plenty of protein here. And the total carbs are about 215, which is about 40% of the calories. It seems like a little high in fat, but I kind of rounded things up. So it was more like 35, a little over 35, so I rounded up. But you could see it's doable, and it looks pretty inviting, okay? So I wanted to mention that when we talk about diabetes and meal planning, one of the first steps that we tell people to look at is, what are the carbohydrate foods that you eat, okay? First you have to identify those, and then you look at the total amount you're having per meal. And then we kind of fine-tune it with the type of carbohydrate. So I wanted to just show you this one slide about the glycemic index. It's one tool that we look at because it emphasizes the point that you don't want refined types of carbohydrate foods, because foods that are processed tend to cook quickly and break down and get digested more quickly and spike blood sugar versus foods that are not so processed. So low glycemic index foods like the 100% stone ground whole wheat has a glycemic index of 55 or less. Or barley, or bulgur, oat bran, as compared to something like white bread that has a glycemic index of over 70. Or potatoes. So especially things like instant potatoes, okay? So all in all, when it comes to a vegetarian diet, what I don't want you to be is a fraidy cat, okay? So embrace and keep open-minded about this type of meal planning. And some of the take-home messages is to first start out maybe by reducing meat, like starting off the week, like following maybe a meatless Monday, and increase your vegetables on the plate. You might have seen from the USDA My Plate. If you go to myplate.gov, which is one of the resources on the back of the recipe I gave you, it has that plate method where it shows you half of your 9-inch plate should be vegetables and a quarter of your plate should be the meat. So that's a good place to start. Are you even doing that? Use meat as a flavoring more than the main entree. Plan and experiment with products and recipes. You're not going to like them all, but be open-minded. You might want to start by going to ethnic restaurants where they do know how to serve vegetarian meals. Thai, Vietnamese restaurants, they use tofu. Chinese, Indian restaurants, they make lentils in different ways and lots of interesting flavors. So remember to count your carbs from the foods like yogurt, milk, soy milk. The rice milk is going to have carb in it, not so much the almond milk. Fruits and grain products, and other starchy vegetables. When you start to incorporate or follow a vegetarian diet, you're going to have to probably monitor your blood sugars more often to see how you're responding. You might need a medication adjustment in some way. It's important to also drink more fluids to aid in digestion, because once you start eating more vegetables and whole grains in your diet, it helps just to help process those new foods for you. And after you follow a vegetarian diet for a while, you might want to evaluate if you're getting enough of all the nutrients that you need and consider a supplement, okay? So anyway, thank you for coming tonight, and hopefully you'll try some different vegetarian dishes. I think it's something that's really interesting. Lots of products out there. We're having new stores open in the area that I think are offering foods to help get you started.